if you ask different therapists and of course different clients as well, they might have a different understanding of what depression is. From my point of view, I would say that as human beings, we're at our happiest when we're in a kind of middle band, which would be what you might describe as calm and alive. So there are various things as far as activities, behaviours, relationships with people that put us in that place. Now, of course, that's not always possible as human beings to be in that place. But if we go above that window, you might say, somebody might phrase that as sort of overly aroused. We could be fearful or angry. And then if we go beneath and sort of fall below, then we can feel hopeless, helpless, apathetic, despair. And then there can be a lack of physical movement, that kind of thing that goes with that. And I think for me, depression is a situation where somebody has a tendency to go below. So their system switches off to a degree. And as I say, the sorts of characteristics of that, the qualities that that might have, is that they might experience themselves potentially as helpless in life, experience a hopelessness, despair, as I say, and that can have a profound effect on every aspect of their life. Their mental health affects our physical well-being, affects our relationships, of course, how our bodies feel, the behaviours we engage in. So yes, it has an effect on every part of a human being, which unfortunately I think for depression reinforces in a sort of vicious circle the experience that human beings have. But that's how I'd characterize it. A few things. So hopeless, helpless, despairing, people might describe that. There's can be a lot of internalized anger that goes with it. So rather than necessarily anger going out to others, it can be turned on self quite a lot. And as I say, that it can result then in a lack of physical movement would be one of the things that you might see as well. Yeah, so as I say, a profound adverse impact, unfortunately, on all areas of life for people. But there can be a range. You know, some people will experience it mildly. Somebody might have an experience of a day or two of experiencing depression. For other people, it's something that's been around clinically quite severely for months or even years in their lives.